Hi, I'm Ash from the MSA, and welcome to What I Wish I Knew in Third Year. This lecture contains advice for you to help you get through your clinical years here at GKT. We've compiled this advice from students from 4th year, 5th year, and a few in 3rd year right now. And it contains tips on what they wish they knew when they started in their clinical years here. This lecture exists because learning on year 3 is completely different than learning in year 1 and 2, and a heck of a lot different than learning in school. In this new ward-based environment, no one really tells you how to learn, and fitting in is hard enough. What's important to learn is also really tricky to know when everything is new. And that problem gets compounded when your doctor is telling you something different than what the textbooks are telling you, and you're not quite sure who to listen to. Hopefully by the end of this lecture, it'll be a bit clearer. In this talk, we'll go over how year 3 and 4 work, and especially how the teaching works, and how to focus your efforts to get the most out of that teaching. We'll go over quickly what kit you need to get through. There isn't much. And hopefully we'll give you a few tips on things to really get stuck in, because year 3 is unique, and you don't want to miss out. Firstly, welcome. Your clinical years change medicine. After 2 years of, frankly, what I thought was drudgery, you get to see patients and you get to help people, which is why I applied to med school. It's your chance to learn some actual medicine, and for me it justified learning a lot of things that I didn't really want to learn in phase 1 and 2, but was on the curriculum. For example, the basal ganglia. Now I know why we had to learn that. So enjoy it. So it's been a little while and you've got stuck in on the wards. You found your feet and you kind of know where you're meant to be. So far, hopefully you've had the chance to meet your firm, and I don't mean the students who you're with, but your clinical firm. The doctors who you'll be working with professionally. Now, you might not have a firm. In NOP, you often don't because you're split between campuses. But on A and C, you should be attached to a group of doctors who work together on a daily basis. Now, looking at your schedule, a lot of formal teaching will have been organized to you. It's a bit tricky because sometimes you'll have to confirm your teaching, and sometimes you'll have to understand that just because it's on your timetable doesn't mean they know you're meant to show up. So a lot of it will be double checking with the doctors and with your schedule to see if you're in the right place, and if not, where you're meant to be. And there's a few things that it's really handy to learn off the bat. How to bleep doctors, how to contact your regs, and if things go completely belly up, if you will, who to contact and how to contact him or her. For example, if your consultants don't show up for your teaching, or if your registrars don't show up, or you get an angry call saying you're in the wrong place, who to contact that coordinates this so we can clear the misunderstanding up. Your teaching in 3rd year is completely different to what you've experienced in 1st and 2nd year. Now, you will have some lectures, but even they're a bit different. But the 3 main ways the teaching is completely new is through formal teaching from doctors, independent learning on the wards, and how you study at home, because that is quite different. We'll go through each of these. Now, for the formal teaching you receive from doctors, there's tips that you can use no matter who's teaching you, because there's a few things that come up over and over again. A lot of the time, and often quite frustratingly, teachers will show up with a brain full of knowledge and without a topic to teach you on. And they'll say, oh, what would you like to learn about? Now at the beginning that's a bit frustrating, understandably, because you have no idea what to learn. But do have a few topics in your back pocket. Open up your Cheese and Onion or whichever book you're using and say, these are the most common investigations in chest, abdo, or NOP, or these are the most common presentations in chest, abdo, NOP, or these are the most common pathologies. And if you don't know much about it, ask them to talk about that, and they will or they won't, but at least you'll have a discussion point to go from, and it saves time. It saves the 15 minutes in confusion of trying to figure out what the teaching session should be on. Now, generally there's about 2 types of doctors, and the doctors teaching you will like their answers in a certain way. One group likes you to guess. When you don't know, have a shot and see what you come up with. But there's a different group who hate the first group, and they say, take pride, be honest, and if you don't know the answer, look me in the eye and say, I don't know. It's a bit confusing on which type they are, but it saves a bit of aggravation. Try and figure it out, because it makes things go a bit smoother. And one of the hardest skills to learn, but one of the skills you should learn at the beginning, is when someone asks you a question, answer systematically. It makes you seem really intelligent when you have a system. Systems that doctors use to answer people often break down into what we call a surgical sieve. And a surgical sieve is best shown in an example. If I was teaching you and I asked, what are the causes of coughing up blood, for example, you could probably get 4 or 5, but the best way to do it is to break it up systematically. And what I use is vitamin C, D. Different people use different acronyms. Vitamin C, D splits up all the causes of pathology into sections. And in order, they go vascular, infective, traumatic, autoimmune, metabolic, iatrogenic, neoplastic, congenital, and drugs. And drugs is recreational drugs. So, for example, what are the causes of hemoptysis? Well, I'll say hemoptysis can be caused by a vascular reason, such as a pulmonary embolism. It can also be caused by an infective cause, such as tuberculosis or bronchiectasis. And using the sieve, you can buy yourself a bit of time as well. But most of all, it seems systematic. It seems like you've thought of this in a critical way, and it really impresses doctors. So do try and make your own surgical sieve. Now, formal teaching comes from a lot of different angles, and one of the most important bit of formal teaching you get is by your firm head. Normally, your firm head meets up with you weekly and organizes either bedside teaching or teaching concepts. Now, bedside teaching is often the firm head taking your student firm to a patient that hopefully they've organized beforehand and teaching you how to take a history and how to do an examination properly. And this is the most in-depth teaching for history examination that you will ever get. It is indispensable. Show up with all your guns blazing and absorb anything that you can, because these guys have taught hundreds of students before. They've been consultants for any number of years. Not only do they teach students, they also examine MRCP and MRCS, and very importantly, they also examine your year-end exams. If you get conceptual learning, if they're explaining something, they often have a habit of being very systematic, which is very nice. And they'll break it down into a framework that's easy to learn from. And all you have to do is listen as well as you can, take that framework home, put it in your notes, and just fill in the gaps. And voila. Now, Reg and fellow teaching is a bit different. These guys are a few years away from being consultants, and they are very intelligent, which becomes very clear when they teach you. Regs give you very in-depth teaching, mainly because they've done their MRCPs and all the knowledge is still right in their head. And they'll take one topic and break it down into its component molecules. Now, sometimes that goes a bit over your head. So it's really key to pipe up and ask questions, to establish context, to clarify things, and to really get the most out of it. There's no point learning letters and numbers if you don't know what they mean or why you're learning them. So be sure to ask questions, and most of the time it won't be just for your benefit, it'll be for the group's benefit. Also, these guys have had to learn really tricky stuff over years and years, and they've developed techniques and mnemonics. Ask them how they remember it, because it gives you lots of tips on how to remember your own self. FYs and SHO teaching is fantastic because these guys are in the first 3-4 years of their career, and they remember what it was like to be a medical student, what it's like to be sweating on the ward in your own shoes. So, ask them. Ask them what's important for you to learn as a third year. Ask them what's important for them to know on a night shift to keep someone alive. And ask them how they got through med school, because all of these things are extremely relevant and they'll give you a good answer as well. Remember that in the Southeast Thames Deanery, where we all are placed for our clinical years, there's a lot of ex-GKT doctors. So ask them how it was for them, and they'll give you tips about exams and all that. And it's great information to have and to share. Now, learning the ward is the point of clinical medicine. It's where you're faced with a whole bunch of patients, and it's your job to improve your own skills for history, examination, and clinical decision making. Now, what you need to do is find a patient by asking a doctor to recommend a patient, taking their history, examining them, getting to the bottom of their entire clinical picture, understanding what decisions the doctors have made, and then very importantly, going to perhaps the doctor that recommended you to speak to them, presenting your findings and discussing about it. And that's where you learn. Presentation is very important because presentation is often how you're graded, how you're respected as a doctor. And it's something that you develop in year 3, 4, and 5, but also throughout your career. So do focus on that. Quantity is important. The more histories you take, the better you get at it. The more times you ask the precisely right question. The more people you examine, the better you are at picking up signs. The better you are at remembering the steps of the examination, which is fairly tricky. And the more natural it looks, which really makes a difference when it comes to OSCEs, or just when you're being examined on the wards by any doctors. The best thing you can do when you're learning on the ward is go to where there's lots of alarms beeping. Go on call, go on take, go on acute admission wards, and it's definitely go to the emergency department. You feel a bit out of place, but if you get in clerking patients, then you get to see medicine on the forefront. You get to see people who are acutely ill. You don't have to read out of a book that someone having a heart attack is grey and sweaty. You can see it in front of you, and damn it, they're grey and sweaty. So get stuck in, go to acute stuff, go on call, because you'll enjoy it and it'll definitely be worth it. Working at home is really important in 3rd year, 4th year, and 5th year. And it's important to get a good set of notes as you go through. The quantity of information you learn in 3rd year is colossal, and you will learn it, don't worry, but it does take time. To save all your note making until the end of the year is a bit silly, because you'll have to start so early on that it just makes it so much easier to just carry on throughout the year. And plus, the more notes you do, the more knowledge that you have on the wards. And when you understand something is happening in front of you on the wards, when you've read about it at home, it's much more sensible, and you gain more from it. So make notes as you go around your rotations. When you're making your notes, have a structure that makes sense to you and which makes sense clinically. What many people do is use the same thing that the Oxford Handbook does, or even frankly Wikipedia does, and say epidemiology. So this thing that I'm talking about, this pathology, how many people actually get it? Is it common? Is it something like heart failure, or is it Osler-Weber-Rendu syndrome, which is interesting to know, but you'll never see someone with it. Tell me about the clinical features, signs, symptoms, what's in their history. Then go to the pathological, the growth pathology or the cellular pathology. What investigations you do, classifications, treatments. And if you use this structure for all the different pathologies you talk about, it'll help you establish context right at the beginning. Of course, it doesn't work when you're talking about how to read an X-ray, but a lot of it is pathology. And whatever you do, try and have a system. For the equipment you need to get through 3rd year, there's not too much actually. A stethoscope is basically the most important thing. It's what you really need, because you'll use it all the time in your chest rotation and all the time in your abdo rotation, and a fair amount in neuro, obviously not much in psych. A tendon hammer is really handy, because when you're learning neuro, you're looking for a hammer, and you know they're often not frequently found. It really slows down the entire process. If you have one in your bag, or if you have one in your pocket, you can just get on with clerking a patient. A pen torch is quite handy to have. You'll use it quite a bit, and they cost very little. You could probably find one on the ward. Not to say that you should nick one, but they're not too difficult to get a hold of. A lot of people ask, do they need a fundoscope or an ophthalmoscope? They're pretty pricey for a good one. I think a a Welsh Allen one's about 130 quid. You probably don't need it. You'll do most of your fundoscopy in clinics or on the wards, and they're not too hard to track down. If you want to practice at home, I guess you could make the investment, but it's a bit pricey, so you can decide that for yourself. Most people don't have one. And I guess you need the uniform. You need to look professional. You don't need to wear a ball gown. You don't need to wear heels, and in fact, walking around the ward in heels is quite annoying. I suppose for men and women. But for chaps, a good shirt, trousers, standard medical school uniform, which is a blue shirt and chinos, shoes that they will get knackered because you will be walking a lot, so something that's comfortable to walk in. Iron your shirts, take care of your appearance, but you're not going to the ball, basically. And you also don't need to wear a waistcoat, really. Don't need to wear a pocket square. You don't need to wear a jacket because it's just kind of extraneous and just gets in the way. Enough about clothing. Books, I put remember to read them at the beginning because a common story is I bought all these books so I'm prepared for third year. No, the more books you buy, one, the more money you spend, and two, the more you'll have to read to actually get value out of them. Most people recommend one big textbook, a good clinical medicine textbook, such as your Kumar and Clark or your Davidsons or something like that. A big reference that you could come home, look something up, and get the entire story. And then something small to carry around the ward. A baby Kumar and Clark is frequently used, and the Oxford Handbook is a good standby. Some people call it the cheese and onion because it's yellow and green. So with those two, you can get through pretty well. A lot of people recommend ECG Made Easy. ECGs intimidate a lot of medical students, and this book makes it beautifully plain. It's the Bible for interpreting ECGs. It's not too expensive either, but you don't necessarily need it. A lot of people don't have it and interpret ECGs fine, but it's well recommended. For your finals, you'll have a data interpretation paper. And there's a book called Data Interpretation for Medical Students. I suggest you Wikipedia it, Amazon it. And if you take a look at it, it'll explain every single thing you need for that paper. Now, there's quite a few in the library as well. If you do your data interpretation studying early, for example, if you learn how to do a full blood count when you're on chest rotation, first rotation, and make decent notes about it, you won't need it. But it's handy to have. There's also plenty in the library. Of course, around exam time, they do get checked out, but it's a good book as well. McLeod's Clinical Examination is very in-depth with the clinical examination. Not only do they tell you how to do it, but they'll tell you exactly what each sign means, and it's a bit of the standby for learning examination. However, it's really in-depth. In the Oxford Handbook, at the beginning, they'll go through the steps of an examination, the reasoning there, at quite a concise level, and McLeod's is the opposite. It'll be very in-depth, but you'll learn how to do it properly. So think about it. With any book, check it out from the library first, and then decide if you want to commit and you want to buy it. Remember, New Hunts is not the only library in the world. St. Thomas's Hospital has a library. King's College London has a library. King's College Hospital has a library in the WEC, and there's plenty of libraries around to get books out. Lewisham has a little one as well. So if something's out of New Hunt's house, that's not the end of the world. Now, specifically for exams and OSCE revision, there's a few books that older years swear by. Masterpass puts out an OSCE book, which is yellow, and if you look around, if you Google it, if you type in Masterpass into Amazon, it will come up. What this book is full of is tick lists. It's lists of exactly what you need to do in an examination. It'll list off, start at the hands, this is what you look for in the hands, and this is what you look for in the pulse. It's good to learn as a recipe for an OSCE, but it doesn't teach you reasoning, and that's about OSCEs. It's about learning what to do and why you're doing it. So that is my warning for studying through Masterpass. It'll tell you exactly what to do, you'll get good at it, practice it, you'll get tons, but remember, it's all about why you're doing it and your clinical reasoning. So make sure to cover that as well. Pass Test, a few editions ago, they used to do books for histories. And what they do is they'd have a patient excerpt, just like an OSCE, and with a friend you could practice taking a history. Notoriously, the school also did very similar histories in their examinations. I'm not sure if they still do, but they have in the past. There's a whole bunch in the library. Take a look at them, and take a look at them early as well, because taking a history is not only an examination, in your exams, it's also on the board, so take a look at it. YouTube is a wondrous resource, because for something tricky like ophthalmoscopy, it's really handy to see someone do it, and YouTube is brilliant for that. There's a lot of medical schools who actually put resources on YouTube from a teaching perspective, and they're great to learn from as well. However, beware that timings and expectations vary from med school to med school. So don't take one video and claim by it. Try and see a whole bunch of different videos and make your own recipe by compiling all the good bits from that. We talked about data interpretation for med students before. It'll sort you out for your data interpretation paper. And Olive, off the virtual campus, is a resource that the schools put out, and it teaches you how to examine people, and it's brilliant. It's your first stop. The million-dollar question in third year is what comes up in exams, because you never know. The answer is, well, I wish I could tell you, but if it's covered in the rotation, specialty by specialty, you should probably learn the lot. For example, in abdo, you study urology. Learn all of urology. Learn all the common pathologies. Learn the investigations. Learn the treatments. Now, you should go into more depth on the things that are more common. You should learn tons about kidney stones, and you should learn tons about pneumonia and tuberculosis and heart failure and heart attacks, because these are things that people often present with. And the school has a reason to ask you, because you should know this, because this is what clinical medicine is all about. And when I mean more depth, learn the side effects as well, which you might not have to do for some other stuff because it's a bit less relevant. Learn the epidemiology more clearly. And at the same time, if something's a weird congenital disorder that, 1 in a million people have, literally 1 in a million people have, maybe learn what it is. So if they throw it as one of the multiple choice answers, you can know what they're talking about and say, oh, this is just completely irrelevant. You can scratch it out with confidence. In your Path and Therapeutics block, it's filled with lectures. And the lectures follow the same rule as year 1 and 2. If it's on the paper, they can ask you a question about it. So, rinse it. Learn the lot. Not only will it make exams a lot easier, but, you might just end up being a better doctor, which is why we're in med school, yes. And clinical relevance. If it comes up on the wards once, write it down. Hear what they're talking about. If it comes up again, learn it more in depth, because the things that are important to doctors are the things that are important to medical students, and that's what'll come up in the examination. And a small percentage of questions will be absolute potluck. That's the unfortunate curse of randomness. It'll be a bit tricky, but hopefully with a bit of luck it's something you've heard of and it's something you're capable of thinking critically about, and you'll take care of it. With regards to that, best of luck. With a few questions that a lot of people ask about, they're listed here and we'll go through them systematically. A lot of the time, and this happens in surgery more so, doctors will ask you questions that are quite important to them, but if you look in a textbook, they're not really there. They're not the most relevant things. And that's a bit tricky because you don't know whether to learn it or not. By and large, if it comes up a lot, learn it, because you don't know what's important to the examiner. You might know what's important to the medical student. So if it keeps coming up, there's no harm in learning it. Also, the doctors know it for a reason, and maybe one day that reason will be posed to you. However, there's some things that are far beyond the reach of medicine. For example, the different types of sutures, that's a bit minutia. but it's a bit tricky. Politely ask the doctor, is that important for a third-year medical student to know? Maybe not if they're quick to anger, but sometimes they'll chuckle and say, I guess not. How in-depth to learn anything about pathology investigations if they're common, if they're used often, if they're life-saving, or if they take up more than one page in the Oxford Handbook is a good rule as well. Learn it fairly in depth. It's a bit tricky to learn, but you get the knack of it eventually. And finally, is the Gordon Museum important? Are postmortems important? Is shadowing a ward pharmacist important? All these things are enriching in different ways than clerking patients and getting teaching. The Gordon Museum is, I'm going to be a nerd, it's really cool. It's also a museum which is dreary and hard to motivate yourself to go to, but if you go there and look at some of the pathology that you've seen on patients, you learn a heck of a lot more. Also, it's a sign-up initiation, or it has been in the past unless it's been changed. So go early, and you actually do learn a lot from it. Also, in the Gordon Museum, they're filled with specimen pots, and you're, until last year at least, guaranteed to get a station with a specimen pot in it at the end of the year, and you have to describe it as a pathologist would. It's best to do that studying early on. Postmortems are an interesting way of learning pathology in a way that is halfway between the ward and the Gordon Museum. And in depth, you see a lot of clinical reasoning in the pathology it's trying to prevent, if you understand what I mean. It's worth going to. Again, it's a sign-off. Shadowing a ward pharmacist is good to see the other side of a drug chart, which is very important for a junior doctor to know. I do it once, get the understanding, and get the respect of what the job is for, but to do it weekly is less than essential. Some helpful websites that we've all come up with. Almostadoctor.com is great for notes. It also has OSCE studying tips. Comb through it because it's pretty handy. Patient.co.uk will save you for grand rounds if you're starting 12 o'clock the night before. Patient.co.uk is filled with pamphlets to explain common pathologies to patients, and also they also have academic pamphlets which explain pathologies. I wouldn't copy and paste, but it's a really good starting block for your grand round presentations, which are explaining pathologies. Biodigitalhuman.com is a great site for in-depth anatomy. It's a 3D person that you can flip around. If you're in your abdo rotation and you do have to learn anatomy and you didn't really understand it in Alistair Hunter's books, which are good to dust off as well, take a look at it. Sometimes if you see it in the context of humans, of the entire body, it's a bit easier to understand. Otherwise, for finals, a lot of third years love practice question websites. Two of the most commonly used ones are PassMed, which is passmedicine.com, or onexamination.com. They're both questions for final years, but final years only have to learn what you learned this year in a little bit more depth. And practice questions really help you understand what's important to learn. So make sure to try at least a few practice questions before your finals. PassMed is, to my knowledge, the cheapest one. I think it's £10 or £15 for 3 months subscription, which is thousands of questions, and it's really handy to learn. And obvious ones, in this day and age, we all study at the Wikipedia School of Medicine. It's a great explanation for common pathologies. Don't use it to make your notes from, but if someone mentions something on the wards and you're on your lunch break, quickly Wikipedia something to understand what it is, what the pathology is, whatever they're talking about, to get a good understanding. And YouTube, as we talked about earlier, is great for OSCEs and also great for understanding concepts. Some lecturers on YouTube are brilliant. And they'll explain things in 15 minutes that you won't get out of an hour reading Kumar and Clark. And that wraps up most of our tips for third year. If you made it this far, well done. Now it's your turn. If you have any questions regarding what's in the slides or any questions about third years at all, send an email along to academicevents@kclmsa.co.uk. we're on the other end, and we'll try and answer as quick as we can to get you some solace. Otherwise, if you have tips on things that you'd like to see just like this, or academic events you'd like to put on, email that, or suggestions at kclmsa.co.uk as well. We'll do our best in answering, and we can also put up a frequently asked questions page as well. From the bottom of our hearts, good luck this year. Enjoy it. I'm sure you'll do great. From the MSA, again, goodbye and good luck. Thanks.